Before we look at atrial fibrillation, let's have a look at the basic structure of the heart and how it functions. Here we have a diagram of the heart. As you can see, the heart is split into two sides. We have the right side of the heart and the left side of the heart. Now the two sides are further divided into a top half and a bottom half. So the top halves are called atrium. So we have the right atrium and the left atrium, and the bottom half is ventricles, where we have the right ventricle and the left ventricle. This gives us the four chambers of the heart, as shown here. Now the right side of the body, or right side of the heart here, brings blood back from the body, passes it through the right atrium through a valve here, and into the right ventricle. The right ventricle then pushes that blood to the two lungs, where the blood collects oxygen and then brings it back to the left side of the body here, into the left atrium. When the left atrium squeezes, again it passes it through the valve here, into the left ventricle, which then pushes the blood back out to the body. So you can see here that blood comes from the body through the heart to the lungs, and then comes back from the lungs into the heart, back to the body. And this is how this human pump efficiently provides blood throughout the body on a regular basis. The valves here on both sides prevent the blood going back into the atrium when the ventricles contract or squeeze together. This allows flow of blood in one direction. Now on this diagram you can see these two green areas here, which are nodes that make the heart squeeze or contract, allowing the blood to be pushed through. The way this works is that we get an impulse that comes to this first node, which is the sinoatrial node. When an electrical impulse hits this node, the node sends a wave across the atrium on both sides. That causes the two atriums to squeeze or contract and push the blood downwards. So the blood will go from here that way. Now at the same time as the two atrium squeezing or contracting, that same electrical impulse will go from the sinoatrial node to the second node, which is the atrioventricular node, or the AV node. When the impulse hits this node, that node then generates its own electrical impulse, which goes down the heart and then goes up both sides, as shown here. Once this impulse goes up, it activates the muscles in the ventricles, causing the two ventricles to squeeze. So it's a cyclical motion where the sinoatrial node gets the first electrical impulse, which then generates a wave across the two atrium, which cause the atriums to contract, and the same wave goes to the AV node, which then sends an electrical wave down, which causes the ventricles. Now, that signal from this node to the second node has to be of a certain strength for that node to be activated. And this is important as we move on to describing how atrial fibrillation occurs. So let's move on to the next bit. In atrial fibrillation, there's a problem with the top part of the heart. What happens is that the signals come through to the sinoatrial node, but there are too many impulses generated from this node. So you end up with many impulses coming across, which cause the atrium on the right and left side to carry on contracting in an irregular fashion. The problem we have is that the impulses are not all of the same strength, and therefore not all the impulses that come from the sinoatrial node generate an impulse that causes the AV node to then subsequently cause waves in the bottom half of the heart. And therefore, only a few of the impulses get to the AV node, causing the ventricles to contract. There is therefore many more contractions occurring in the top half of the heart here, in the atrium, than there are in the bottom half, which is the ventricle. The heart rate can increase to over 100 beats per minute, or it can sometimes drop to quite low number of beats, to less than 60. But it's this irregularity in the strength of the impulse from the sinoatrial node to the atrioventricular node that causes the irregular heart rate. This should hopefully now give you some insight into how atrial fibrillation occurs, and as the word suggests, atrial referring to the two atrium, and fibrillation refers to the fact that the top half of the heart, the two atria, are fibrillating but not always generating sufficient strength to activate the bottom half of the heart. With regard to treatment, there is a number of options that are available. The fact that these atria are fibrillating causes irregular blood flow within the heart. This can lead to blood clots being formed, which can then be pushed around the body, leading to various problems such as strokes. Therefore, firstly, in a patient with atrial fibrillation, the GP will consider the necessity to anticoagulate the patient, in other words, thin the blood down, and there are various medications that the GP can provide to thin the blood down and minimize the risk of blood clots forming. The second option is for the heart rate, depending on how fast the heart is beating, is to slow the heart rate down. So again, that doesn't cause complications to the body. The third and fourth options are for hospital services, and this may be down to a process called cardioversion, which is where a controlled electric shock is provided to the heart to try and regulate the nodes into a rhythmical process again, so that one impulse from the sinoatrial node goes to the AV node, which then passes round the bottom of the heart. That should hopefully get rid of some of these irregular rhythms that are occurring in the top half of the heart. Finally, the other option is catheter ablation, where the area inside the heart that's causing the abnormal heart rhythm is destroyed using radiofrequency energy. After this, there may be a need for a pacemaker depending on how the heart rate continues to beat. So this provides some insight into how atrial fibrillation occurs. There are various websites where you can get further information on atrial fibrillation.